Finding Your Way with Ocular Melanoma, join me, host Tara McCannell, as I share with you everything that I know about this rare cancer. I hope you will learn, get your questions answered, and better understand what is happening, how this disease works, so that you can take action to live your best life. Visit my resource page, sayhart.com/ocular melanoma. That's SEYHART.com/ocular melanoma, all one word, for more content and support. Spread the word of this information. Share with friends, share with your doctors, share with people that you know who may be undergoing this journey that you are also on. Today, I'd like to talk about vision loss. This is a very important topic because this is the first jolt that people think about when they get diagnosed with eye cancer. I'm going to lose my vision. And unfortunately, there's so much emphasis on vision loss that's a lot of the time, that's all that's on people's minds when they get this diagnosis. Yes, they are being diagnosed with cancer, and cancer in itself is frightening because of the unknown and the uncertainty. However, adding vision loss on top of that makes this a very challenging diagnosis for people. So I want to talk to you a little bit about what vision loss means in my perspective as an ocular oncologist who sees thousands of patients who have ocular melanoma and have been there as things change or not with their vision. So the first thought that I want to share is when people hear that you could lose their vision, this is what we immediately think of, and this is not correct. I'm not going to see anymore. I'm going to go blind, and I'm not going to be able to do anything anymore. I'm not going to be able to work. I'm not going to be able to drive. I'm not going to be able to look after my family. I'm not going to be able to enjoy things in life because I will not be able to see. This is what people jump to. And I must tell you, nothing is further from the truth. So, what actually does happen? First of all, ocular melanoma affects one eye. In most people, both eyes, in most people, the eye that doesn't have the melanoma is usually fairly normal. Not everybody, but the majority of people who get diagnosed, the unaffected eye is in good order. Can you function in life with one eye? The answer is absolutely yes. Many people have lost vision for many reasons that are not eye cancer. Trauma, retinal detachment, getting a vein occlusion, getting a dense cataract. There are so many reasons why a person might have poor vision in one eye that have nothing to do with this diagnosis. And these people, because many of the time it is due to something related to the retina, we see these people, thousands of these people in our practices, in diagnosis and follow-up and treatment. And many people have one eye that's impaired by some sort of ocular disease, and the other eye is fine. And these people are carrying on in life. They're working, they're caring for their families. Their bad eye is very minimally affecting their lives. So just know that you might have some change or loss in vision in the melanoma eye, but just like thousands of other people who have one eye that is slightly off and one eye that is stronger, you can move forward in life in pretty much the same way that you have been doing all along. And this is the experience for the majority of people who get diagnosed with ocular melanoma. So there's a lot of hope and possibility here. Don't let the idea of vision loss and the very extreme ways that we naturally, our brain goes to think of the worst case scenario, and then we're messed up. So take a pause and know that even though You may lose some vision in the affected eye. The chances are very high that you will continue to do the things that you enjoy, the things that you need to do in your life, and be responsible for yourself. This is the majority of people's experience, that having some visual impairment does not significantly affect their life. Please keep this in mind. Now let's talk about how a person might lose their vision in this diagnosis. There are two main ways that ocular melanoma gets treated. Number one, which is less common, is removal of the eye, and that's called enucleation. Why would a person need to have their eye enucleated? Usually one of two reasons. The vision is extremely poor at the time the melanoma, is discovered. If the vision is extremely poor, meaning you can barely see anything out of the eye, like barely see shapes, when we do treatment, usually that minimal vision may be lost. The other reason is that the melanoma is extremely large at the time it's diagnosed, so big that we don't have safe treatments for. So if the eye is removed, the vision will be immediately lost, if there was vision to begin with. And for many people who, certainly in my practice, who I make the recommendation for enucleation, it is one of the easiest things to adjust to, because the person has already been getting used to their life with not really seeing well in one eye. And when they come to see me, they're driving, working, they're doing everything that they normally did. And so when they have the nucleation, it's a very, very smooth transition, because the eye that was affected wasn't really serving that person visually to begin with when the melanoma was diagnosed. The second most common way, I'm going to say the number one common way that ocular melanoma is treated, is using some form of radiation. The most common way that radiation is delivered is with brachytherapy. Brachytherapy is a word that means you place the seeds of radiation in a carrier and you apply this treatment to the organ. In ocular melanoma, the brachytherapy carrier is called a plaque. And a plaque is essentially just a disc, a circle, that's made with gold, because gold prevents the transmission of radiation, with seeds of radiation calculated to treat the melanoma that is going to be treated, placed in a resin on the opposite side of the gold disc. And this gold disc gets placed on the outside of the eye with the radiation directed towards the eye. So if you are standing next to a person and you see the gold disc, there is no radiation, or very little radiation detectable on the side of the gold. So brachytherapy plaque is the commonest way that radiation is delivered. Radiation can also be delivered with proton beam radiotherapy, and in some cases, stereotactic treatments as well. But most commonly, brachytherapy plaque is the number one common treatment that we treat patients with. And we focus on brachytherapy plaque because the side effect profile is so much better than many other forms of radiation. So how does vision get lost after brachytherapy radiation? When we kill the melanoma, when the tumor gets treated, the radiation that is used and calculated to destroy the tumor may affect some healthy tissue that is not melanoma on the inside of the eye. So sometimes a person might have tissue that gets damaged that is not the melanoma. And the unusual thing about this is that each person responds slightly differently to radiation. You can have the exact same melanoma size, melanoma location in an eyeball in 10 different people, and each of those 10 people are going to have a different response to the radiation. So what does this mean? It means that radiation side effects, vision loss from radiation, is highly unpredictable. Yes, when you step back, you can say the more radiation the eye gets, the higher the risk of complications. The less radiation we give, the fewer the complications. But there is so much variability in between. Makes this very difficult to study. So with all this uncertainty, I think this is sort of exciting because there's something we still don't know about in our human physiology. What is it that makes some people seem to be minimally affected by radiation and others who seem very affected by radiation? So we don't quite know at this point what it is, what is our differences that makes us respond better or worse to radiation. So you just never know. If your doctor says, well, you're going to lose your vision, this is what's going to happen, this is what's going to happen, you can know that, well, we know that radiation side effect is highly variable and somewhat unpredictable, so I might not lose all my vision. I might only be affected a little bit. So please keep this in mind. Nothing is a done deal. Nothing happens for sure. We can't accurately predict what is going to happen with radiation. Yes, we can look at numbers and statistics, but there are so many people who surprise me, especially people who we just think this person's probably not going to see in a number of years. And then they see really pretty well for what the eye has undergone. So we don't know for sure. So know that you might lose a little bit of vision, your eye might be not quite affected. But what I tell people is you're going to have eventually, most people notice that the melanoma treated eye is a little bit weaker than their unaffected strong eye. But how does this affect our vision? Vision, sight, living in the world is based on images that come to the brain from both of your eyes. So if you have a strong eye bringing sharp, excellent vision, full field of vision, and you have a weaker eye that brings a little bit altered vision, maybe there's some areas missing, and you put that together and those signals go to the brain, your brain will sort things out. Your brain will take the best of the vision from the weak eye and put that all together to contribute to your overall visual experience. So when a person has an eye with some vision loss related to having had brachytherapy to treat an ocular melanoma, your brain will sort this out. They will say that, yes, my eye is weaker, but I'm doing everything I did before. I enjoy activities. I take care of my family. I'm able to drive. Yes, people will have a little bit of transition depending on what exactly they experience. But we see that even a weaker seeing eye is important in your overall vision. So because of this, I try to think of any possible way to save eyes. Even if you have a big tumor, treat it with brachytherapy if you can cover the margins. And, you know, consider enucleation only as sort of a very, very last option. Enucleation, in my opinion, shouldn't be an option just like you can have the plaque or we can just take the whole thing out of your eye. We already know that survival is not improved when we take eyes out. So why not do all we can to save the vision? Make the vision as good as can be, because the brain, your brain, will figure out how to make things work so that you can continue to function. And that's why I always tell people, please do not patch the eye treated with the melanoma, because you might struggle because the differences of the image that you're getting that are being fed to your brain, but go through the transition, get used to it. Because if you can keep using both eyes together, your brain will figure out how to get you seeing, how to get you the best possible vision with both eyes together. So there's always hope. Even if you lose some vision, or even if you lose a lot of vision and you just have some peripheral vision, that peripheral vision is very important. There is so much emphasis in ophthalmology on our results when we read the eye chart. Oh, you're not 20/20, you're 20/40, you're 20/50. What does that even mean? How does that translate into how you function every day? And so when people come to me and say, well, my doctor's really upset because my vision is 2100 or 2080 and I'm still doing the injections and you know, you know, as doctors, we transfer a lot of our anxiety onto our patients. And so I tell people, well, are you back to everything you did before? Are you driving? Are you working? If they're saying, yes, yes, everything's like they were before, but I'm really, really upset because this eye doesn't see. I'm like, well, if you're doing everything that you need to do in your life, what else are we expecting from our vision? That's the purpose of our vision, to allow us to do things, to function, and to do well. So I just encourage you, or I invite you not to get hung up on a Snellen visual acuity eye chart result. The result you need to look at is, what am I doing with my vision in my life? How is it getting in the way? What are things I can work on? And if you're sort of newer in having visual change, a lot of that is transition and sort of spending the time using your eyes together, getting used to the way your brain is taking information from both of those eyes and putting them together to allow you to function. So I say, if you're not bothered by your vision, please don't let your ophthalmologist's anxieties and concern bother you about your vision. And of course, we want to do everything possible to get the best possible vision. There's no question about that. And I think it's important when you go for your checkups, when you see your ocular oncologist, that they look at both eyes, that they focus on looking at anything we can do to make your vision better, not just in the treated eye, not just in the good eye, but both eyes, because any little thing you do to make one or the other eye better is going to improve your overall vision. And that's why I always tell people, if you have a cataract, just get it treated. Don't wait till the last possible moment. There's so many other conditions that I feel sometimes get forgotten, that conditions where we have good treatments for. So make sure that you're seeing your ocular oncologist. I always tell people, why don't you also see another retina specialist or your general ophthalmologist? Because sometimes there's so much effort focused on the melanoma that people may forget about what else can be done to get my vision, my overall vision, the best it can be. So, what are the things we can do to have the best possible vision? Early treatment. I think that we're slowly moving away from the idea that melanomas have to be at least 2.5 millimeters in thickness. Melanomas can be 1 millimeter in thickness. And if you see signs of activity and retinal detachment and the cancer being active, absolutely treat the melanoma. But also be cautious, because sometimes people get treated and maybe they don't need to get treated. So back to some other things I always talk about, get opinions, see more than one person, get a few sets of eyes on your condition before a radical treatment recommendation is made. And I consider radiation treatment very radical. So if someone says, we're going to radiate you, please get a few opinions so that you can feel absolutely comfortable that that is the best decision for you. The same thing goes when someone says, we need to take out your eye. Please get a few opinions, because that is a very radical treatment to remove an organ in your body. So do the due diligence, take charge. What if your doctor is wrong? I tell everybody that. And people who see me, I said, if they mention second opinion, like, okay, I'm going to give you 3 people that you can see. And because it's so important. And then, one of the things that we do at UCLA is we use an oil bubble. And we put this oil bubble inside the eye because it is denser than the natural liquid in the eye. And the density of this oil bubble helps to reduce the radiation that goes to the non-tumor tissues in the eye. And we have already published many years ago how this improves vision, how this results in fewer eyes with very poor visual outcomes. And part of what the oil bubble does is that it can also treat retinal detachment. And nearly all melanomas, especially the bigger they get, have some amount of retinal detachment with them. And the oil bubble is like the only thing we can do to keep the retina in position so that it is not slowly dying. So when the tumor dies, the retina is all attached, and this can help with your peripheral vision. And all of your vision is important, not just your eye chart vision. It's It's really your whole peripheral vision, how you function with your vision. So I hope this was helpful, and I want you to leave knowing that just because you have a melanoma in your eye or that you've had treatment doesn't mean that you will lose all your vision and not be able to function. In fact, it's kind of the opposite. So I hope this was helpful. Please know that the majority of people who undergo brachytherapy to treat an ocular melanoma continue to lead productive, busy, active lives. Thank you.